Governor Jindal is addressing Louisiana residents' concerns over the swine flu threat in Baton Rouge as we speak.
That's right, Blue, and that comes as the WHO, or the World Health Organization, raises the level of alert to 5, which is pre-pandemic stage. Let's listen in to what the governor has to say.
Consider closing upon getting a confirmed case. In terms of the medical stockpiles, you may remember that I had told you earlier in Louisiana we already had over 400,000 courses of treatment. In addition, we've received approximately 140,000 courses from the federal government. We have now, I've directed the National Guard, state police to pre-position the 140,000 courses that we received from the federal government at several locations throughout the state so that they'll be available if needed. And I'm going to share with you some guidance in terms of what physicians should do. In terms of doctors and pharmacies, they should continue to request their antivirals from their normal sources, so they should continue to request those antiviral medications. These supplies will be available as other private sector resources run low, but it is very important that medical professionals continue to follow the guidance that they're getting from CDC in distributing antiviral meds, and they continue accessing their normal private distribution networks and channels. In terms of what we're also doing at the state level, we're sending emails to our state employees as well as managers saying, first, if any state employee has got flu-like symptoms, they should be placed on sick leave, told to contact a physician, and to stay at home. If any state employees have been in contact with somebody who has a confirmed case, and obviously, again, we don't have a confirmed case in Louisiana at this time. If any state employee has been in contact with those that have been a confirmed case, they should be put on enforced leave or sick leave for at least 3 days, or be given the option of working from home. But in other words, if we have state employees that have been exposed to those with a confirmed case, we are requiring that the managers put them on enforced leave or sick leave, or allow them to work from home from 3 days. We're also asking our managers to provide flexible work hours, telecommuting, and other options to their employees to help them as we continue to deal with these flu cases. A word of caution to those with underlying medical issues, those that are in high-risk groups, those with compromised immune systems, cardiopulmonary disease. The CDC has said that if you have an underlying healthcare issue, you may want to consider staying away from large crowds. Now, this is a population that normally would do this even during a normal flu season. However, during a normal flu season, they would normally be able to get a flu shot. They'd normally be able to get a vaccine. These are individuals that if they get the flu, it would be a more serious case for them because they already have a potentially compromised cardiovascular pulmonary system, and so influenza would be even more serious for them than the general population. A couple of other state agencies.
Of course, that was Governor Bobby Jindal taking a very active approach to the swine flu, or the threat of the swine flu.
Return.